So I'm going to talk about the Quitline, free quit services for all, and give you an update. I have nothing to disclose, no conflicts of interest or anything. So first, I want to make it very clear. I'm going to give you an update on the South Carolina Tobacco Quitline, but Sharon alluded to a few of the cessation efforts that we have. I would be remiss to not say that there's a lot of cessation efforts that we do and partner with others across the state. This is just a few of the efforts that we either fund or support or work with, or partners that we are beginning to work with, from our really good expanding Baby and Me program, from the data and surveillance efforts that we have, our Dr. Dan Kilpatrick and Jaron King, Jaron, I mess up your name, I'm sorry, darling, with our surveillance and evaluation staff that we work with here, the efforts that we're working with our MUSC Health Tobacco Treatment Program that we just had a meeting with yesterday. Sharon alluded to the Quit the Hit social media program that we have, our Medicaid access and cost sharing program that we have with the Department of Health and Human Services, where we actually share the cost of the services that we provide to Medicaid beneficiaries here in South Carolina. She mentioned our wonderful new community-based tobacco disparities program that Rayada Scott of our program heads up. Our cessation support of tobacco-free public housing that we work with to support the work that Helen Deacle does of our staff. Our Can Quit Oncology program, of which Chad Dingham of Gibbs Cancer Center right up here at the front is one of our champions in that area. We work with our health region, Suzette McClellan. I mean, just tons of y'all from our Susan Collier. I see you here. I don't know who all's from our health regions, but our health regions do a wonderful job of supporting what we call our 2As plus R efforts of working with DHEC clients who smoke and doing that brief intervention and referral to the Quitline. We work with alternative cessation resources for local courts, local magistrates, and municipal judges in supporting their efforts when youth come before their courts for getting caught smoking or vaping, and trying to provide them with alternative resources in lieu of fines. We are trying to work and build resources and partnerships with our Indian Health Service in Catawba Indian Nation, providing resources to them. Catherine Warner, she's our outreach coordinator of our staff, has done a remarkable job of developing resources and materials that are tailored just for our American Indian population, our indigenous folks in South Carolina. I every year go to teach classes for our mental health, for our Midlands dental health program at Midlands Tech. Be doing that next month. We work with our local coalitions to support them in every way that we can. We work with parents and families and supporting them. I know Smokefree does a tremendous job. Smokefree South Carolina does a tremendous job in supporting families, and work with faith organizations. Our Hold Out the Lifeline is a big supporter of our health equity and our community-based disparities program. We contract with them to support that program. Our Midlands Health Region is using community health workers in a unique way to work with a cessation piece with our 2As plus R. And policymakers, we work every way we can to support local policymakers in their efforts. So I just wanted to throw that out just real quickly, because I took advantage of my extra time on that one slide, okay? All right, so here's the Quitline and some updates for you. So a little background. Nationally and in South Carolina, Quitlines are free. They provide what we call quit services to support quitting tobacco products, including vaping. We provide what is evidence-based behavioral counseling and medication support with a coaching team. Every state and U.S. territory has a Quitline, which means from all of North America, every Canadian province, as well as state and U.S. territory, has some level of a Quitline. South Carolina's Quitline launched in 2006, so we will be 16 years old in August. We are the baby Quitline of the United States, okay? We were, in fact, I know y'all find this hard to believe, we were the last state to get a Quitline. Imagine South Carolina being last. I'm a native. I can talk about my state, okay? We're last in a lot of things. First in the bad things, last in the good things sometimes. Our services are free. There's no insurance required, okay? Although we try to reach out to those who have no health insurance. I'll talk more about that, but we do not require insurance. That's not an issue. Coaches are all trained tobacco treatment specialists. In fact, our vendor Optum is a provider of tobacco treatment specialist training. We have done everything we can to provide barrier-free access. We are open 24 hours, 7 days a week, except major holidays, except we are open on New Year's Day to help people make that decision to quit for the new year. So something that's new that some of you may not know about is something we call 123 enrollment. Click, call, click, or text, okay? So we can call our traditional toll-free number, 1-800-QUIT-NOW, or there's an online URL to click online at quitnow.net/South Carolina. And the newest way of accessing and enrolling is to text READY to 200-400 on your mobile phone. Multiple languages and accessibility has always been something that our vendor has been able to provide. We serve ages 13 and up. We provide Spanish speaking either through our De Lejo Ya line or also Spanish through Quit Now, the Quit Now line. Native Americans is something we launched a year ago. Have a dedicated line at AI7 Quit. We have our TTY access, a deaf, hard of hearing line that's dedicated. Other folks that have other language preferences are automatically transferred to someone who speaks their language. So we try to do everything we can to be as accessible as possible for whatever the individual needs. We have a number of what we call customized programs. Not necessarily customized in terms of low income, but just understand that we don't turn pretty much anybody away. Our Quitline originally started for the low income, okay? So we originally started our Quitline in 2006 to serve Medicaid and low income. And we quickly knew that folks with no insurance needed help quitting, the uninsured, Medicaid. And then we realized that folks, even with insurance, weren't getting the help that they needed. So we call these folks underinsured. So they may have health insurance, but they don't get the gold standard. They may have caps on what they can get. They may not offer full range of counseling. They may not offer the full range of medication. So we will serve them. We don't cap how many times someone can enroll, although if they are within that window of, say, 90 days and already enrolled, they have to wait after those 90 days. But we will still enroll them, a couple of times or so during the year, 2 or 3 times during the year. Medicare is included as well. Our oldest person to quit with the Quitline was 100 years old, and that was a year ago. So it's never too late to quit. Isn't that amazing? We have a behavioral health program that we rolled out 2 or 3 years back. Actually, it was prior to the pandemic. I am very proud of this program. We work with folks who are tobacco users who have co-occurring mental health and alcohol and drug conditions. We triage them at intake. We have specific questions that are asked, and if they believe that their co-occurring mental health or alcohol and drug condition will interfere with their quitting and they want to be triaged into this program, we will do that for them. You're going to hear more about that when Lamar Suber speaks about this wonderful program in our partnership, and I will say a little bit more about that with a slide. We work with our pregnant postpartum women. We follow them during pregnancy and after delivery to prevent relapse. We have a Live Vape Free program. We offer 2 mobile online support components, one for youth and one for parents. I have a slide on that I'll show you. And then we have our relatively new American Indian Commercial Tobacco Cessation program, our AICTC program, that reaches South Carolina's indigenous, Native American tribal groups. And then we have our rural health oncology programs. Those are not necessarily the same, but we work with rural health folks through our health systems program and working with FQHCs, and then our oncology program working with cancer centers through our CanQuit program to implement electronic referrals, and I'll say more about that. So there's been a bit of a shift from talking about tobacco use and smoking to nicotine dependence. And vaping, the vaping epidemic has kind of brought that about. If you're smoking, you're still consuming nicotine. If you're vaping, you're definitely consuming nicotine. So we're using the term nicotine dependence more in our language than ever before. Behavioral counseling support with a coaching team. We're using the term coaching team more than anything else rather than a quit coach. We do provide heavy behavioral counseling, which is the whole range of cognitive behavioral therapy, motivational interviewing, and all that entails. I didn't mean to do that. We do provide only counseling, though, for those who are under age 18, no medication, and those who are pregnant or breastfeeding. So no medication for that, those particular two cohorts. We provide an NRT, nicotine replacement therapy, patch, gum, lozenge, or combo, which is evidence-based. We do that from a range of a 2-week starter kit all the way up to the maximum of 12 weeks of dosing, and we do that in 4-week shipments. So when people get the full range of dosing in 4 weeks of shipments, they have to stay involved in counseling. For people who get just a 2-week starter kit, we call that our individual services program. At least right now we do. And they don't have to be involved in counseling. If all they want is a 2-week starter kit that will help them make that decision to put down their cigarettes, then we will just send them a 2-week starter kit and they don't have to be enrolled in counseling. That's part of one of the changes we made to help people make that decision to make a quit attempt. We do provide a materials printed quit guide, but only for adults. We stopped doing that for youth a few years back. Then for youth, we provide social, mobile, and digital resources. We do provide customized support materials for a wide range of individuals who are enrolled, smokeless, vapors, users with chronic health conditions, and lots of others, LGBT and others that have their specialized customized materials that speak to their population. For our behavioral health services, a little more about that. You see very similar protocols, but with our co-occurring mental health conditions, that covers depression, general anxiety disorder, ADHD, bipolar, schizophrenia, a few examples. And then co-occurring substance use disorders, alcohol abuse, other drugs. So it's anywhere from opioids, fentanyl, heroin, cocaine, you name it, we will work with them. They both, whichever category they fall under, they will get a dedicated coaching team. They will all get intensive behavioral counseling methodologies, 12 weeks of combo NRT dosing, which is evidence-based, and then referral to community treatment services, which means we refer them back to their local alcohol and drug abuse treatment center or their local mental health, community mental health treatment center. Okay? Vaping. Some of you may not know that we have a Live Vape Free program. We have not heavily publicized it, but with the component for teens, they can just get started at texting Vape Free to that number. It's access on their mobile phone. They can enroll and see what motivates them. It's interactive content, and it is AI, artificial intelligence, which means there are keywords that if the youth puts them in, then automatically the app knows to pick up on those cues and apply artificial intelligence, which I'm learning a lot about AI, and I'm very fascinated. It's the part of me, I'm fascinated but yet troubled at the same time that AI tracks, and I try to stay away from that kind of stuff. I'm not on Facebook, and I never will be. We can ask me about that later. Live Vape Free for the parents and the families is they can explore more and get support at rallyhealth.com/livevapefree. It helps these parents talk with their teens about vaping. It also offers a self-paced online course, but then they can also get one-on-one support with a coach online to get tips and tools to help them work with their teens, and then it's a downloadable toolkit. And these are 2 tracks that don't cross each other. So the parents can be doing their thing, and their teen has no idea that they're getting support to work with their teen. And the teen can be doing their thing with getting vaping support, and the parent doesn't know that they're getting help either. So we are hoping and praying that this will help make a difference, and we're hoping that along with our Quit the Hit program, that we will start making a dent in vaping. You know, y'all, addiction is powerful. It has a powerful hold on the brain and the body. I don't know, I'm holding out for hope, but it's a tough nut to crack. So we have a provider services program that we've been working on, and we launched actually our provider referral program in 2009. So we didn't have the capacity to do this when we launched our Quitline in 06, but we did launch it in 09. So we have both fax referral and electronic referral. External providers have a certain form to fax to Optum, and they get outcomes returned back, and our health regions use a different form, which we are updating. And then there's electronic referral via our South Carolina Tobacco e-referral hub, and it's through providers' EHRs, their electronic health records, or EMRs, as some call it. We shorten it for our e-hub. So this is everything runs through our e-hub, and we're working with providers now. Our newest champion provider is Gibbs Cancer Center. And the difference we have seen from converting Gibbs, Chad's not in here, he ran away, but the difference we have seen from converting from fax referral to e-referral is a difference of Chad, I'm singing your praises, is a difference of converting from two-digit capacity to triple-digit capacity in terms of provider efficiencies. Now, we're still working out the kinks, Chad, aren't we? And there's still questions. But we are seeing the value of enabling electronic referral. Our vendor is Telask, and I want our three vendor representatives to stand up. Peter Fallis, the president of the company, Aaron Greenwell, our project manager, and Vince. Vince, I blocked on your last name. Please forgive me. Vince, what's your last name? Thank you. So Vince and Peter come from Canada. Aaron comes from Seattle. They came a long way to be here. So they are in this week, and we are working the rest of the week, and could not be prouder of the work they do with our providers. So the next program that we offer to our providers across the state is our health systems optimization program. I sent y'all an email, Amanda and Logan and Lorenzo. So we were calling it Health Systems Change Program, but Chad, somehow providers don't like the word change. So optimization, we're changing the name. So it's our Health Systems Optimization Program. We have locally based provider outreach specialists that they provide free on-site and virtual training, even lunch, that provide lunch. They provide technical assistance, other support to South Carolina providers. Our PO specialists are TTS trained, I'm proud to say. And we have Jo Wardell, who lives up in Delaware. She is our Optum manager of this program. And our health systems optimization goal is to optimize brief tobacco intervention, BTI, in standard clinical care across South Carolina health systems. And as I mentioned, our Optum manager of training and outreach programs is Jo Wardell. She, of course, is not with us today. But our South Carolina provider outreach specialists who live here in South Carolina but work for Optum are Logan Bernstein, Lorenzo McCrae Jr., and Amanda Stephanakos. I want them to stand because they are here. I want y'all to see them. I could not be more proud of this team. Thank you. They work hard on our behalf. Okay, so not too much more. So we have partnerships that we work with, and this is not all of them, but the key ones that are keeping me busy is our Joint State Agency Smoking Cessation Initiative, which Lamar is going to talk more about. This is, well, Dr. Fields is working me, so I love her. So DHEC Department of Mental Health and Department of Alcohol and Other Drug Abuse Services have what we call a joint state agency smoking cessation initiative. And we were doing this before it was cool, okay? And so this all ties into our Tobacco and Recovery Leadership Academy that we held in 2018, and we're continuing the work of that. But all things behavioral health, we are doing under this partnership. But also, both agencies are doing their own behavioral health initiatives for smoking cessation. I could not be prouder because I've worked for both of these agencies, and both DMH and DeOtis have carved out their own nicotine and tobacco lanes themselves. And so Lamar's going to tell you about DMH, I know. And then with DeOtis, they got like a ton of money for opioids, I think more than COVID. So State Opioid Response Grant, when they contacted me, they said, Katy, guess what? SAMHSA wants a nicotine dependency piece. And I'm like, well, I'm on it. And so we wrote the Quitline into that. And so I'm part of the opioid use disorder grant. So that's how that fits, okay? And I have trained grantees on the Quitline and on making referrals and all that. And so SBIRT, if any of you know what SBIRT is, SBIRT started, and I was involved early on with DHHS, with pregnant women, with violence prevention, alcohol use, depression, smoking, and all of that early on when Tony Keck came to South Carolina. I'm dating myself, but all I'm saying is SBIRT started early on, and then DeOtis got an SBIRT grant, and I was involved, and then the pandemic knocked it down. Pandemic shut everything down. And SBIRT was still there, but now SBIRT is ramping back up again. In fact, Lisa Davis wanted to meet today, and I'm like, no, I'm at the Smokefree Summit. So Lisa at DeOtis, SBIRT is ramping back up, and it'll be substance use disorder. So there's an opioid use disorder piece and a substance use disorder piece. But the nicotine dependency piece and smoking is part of that as well. And so screening, brief intervention, and referral to treatment is going to have the smoking piece as well in that. And then I could not be prouder because it is long overdue that we address pulmonary health and smoking, and especially with COVID highlighting this. And so we have a contract with the South Carolina Society for Respiratory Care. We are getting ready to launch a brand new online training for respiratory therapists, and it is being vetted by the South Carolina Society for Respiratory Care. These are wonderful people to work with. And so we are carving out a place for them, and very, very great partners to work with. And so there's others that we're working with on building health equity partnerships with other entities to address tobacco use and nicotine dependency among high-risk and vulnerable populations. So Quitline numbers, because I know you want to know. So I hope before I retire we're going to reach 200,000, but so far it looks like we've served about 180,000 South Carolinians through the Quitline. Our provider referrals, though, I got to say, and Aaron, this started with you when you were with Optum, back in 2014, when we started doing, and then when we hired Amanda, Logan, and Lorenzo, when we started hiring y'all and got our health systems program going, that's when our provider referrals started really ramping up. Because the first year we started, we had 200 provider referrals. But since startup, we have had 46,425 patient referrals from providers. So the doctors are doing it. Our current quit rate, yes, I know that confidence interval, Dan, is a little wider than we want, but it's the trend, the 10-year trend that we're looking at. Our current quit rate in South Carolina, which is one of the highest in the states, I think, 41% compared with 29% 10 years ago. So we're doing something right. Our participant satisfaction rate with services is 98%, so they would recommend the Quitline, and that speaks well. If they didn't, we'd have another vendor. Our return on investment, which is tricky, but our ROI is about $250 to $350 saved for every $1 spent. So I think that's a good investment because we spend a lot of money, but we save a lot of money. So new on the horizon, I know y'all want to know this because guess what? We're getting ready to change the game. We have a new quit services platform coming this fall. Optum is going to move to what they call the Rally platform. It will be a digital platform. They will still have 24/7 support from a highly trained coaching team. Individuals can choose either traditional to digital. Health equity lens will be of paramount importance. The customized programs will remain the same. We will have a quicker delivery of NRT. There will be a 3 to 4 day delivery instead of 7 to 10 day, which I am very happy about. Seamless transition for the participant, and as I said, a planned launch date for late 2022. So going digital, more individual preferences, added services to address tobacco, vaping, and other products. And I wonder what those other products could be. You reckon marijuana? Oh, no, yeah. Yes. If you smoke it, we're going to address it, okay? Except maybe smoked meats. We are also moving toward a more health-focused, holistic approach, which I like. So when you're talking to you about smoking and vaping, the coaching team will also talk about your stress, your sleep, your diet, and all those other aspects, because you are the whole person. And I think that is critically important. And I like that aspect of Rally Health. We should have been doing it all along. So stay tuned, y'all. The best is yet to come. So the last thing I want to tell you is drum roll. Mike Cummings isn't here, but they've done a quit challenge. And so we're getting ready to launch what we call a mini quit challenge. It's a 12-month challenge, and it's a campaign to encourage quitting across the state. There'll be a $100 gift card prize, one winner every month, up to 12 winners. There's heavy media, TV, social, digital placements all over the state, targeting the typical nicotine user in those places where people, just all over the state, and the placements are amazing. In fact, the team that showed me the media plan, I would think they lived here and they knew our folks. Recruitment will be starting soon. There'll be a URL to sign up. So there'll be a Facebook and YouTube and just everything out there. So the launch date is set for May 30th. It's coming up quickly. To my knowledge, it's the first statewide challenge of this type, and the Quitline will be promoted every month. So the whole idea is to encourage quit attempts and then to lead people to the Quitline, hopefully that they will continue getting support. So there'll be a $1,200 investment and a whole lot of investment in media, but we hope that the payoff will be big. So we'll let you know how those results are, okay? All right, last but not least, this is who to contact. This is me. And certainly this is my last big introduction, is I want Catherine Settigren to stand up. I am introducing you to our new, this is our Quitline assistant manager. And, August will be her first year with us. So, because I'm not going to be here forever. Yay! I'm sorry. I should have been so happy. Anyway, very, very happy to have Catherine with us. So, because yes, we did hire a bunch of new staff. So, happy to have Catherine with us. So, I am happy to share my slides with anyone. And, I've got cards. If you want to get a card and email me after the summit's over, I'll be glad to share my slides with you, okay?
So Jim Thrasher, professor, Arnold School of Public Health, University of South Carolina, and also president of the board for Smokefree South Carolina. So glad you all are here today. This is a big crowd, and it certainly is rejuvenating for us to see everybody showing up. Katy, can you say a little bit about what's the relationship between TELASK and the Quitline? People who are going through the TELASK program, are they also getting referred to the Quitline? Are they seen as completely separate channels? How does that work?
So TELASK is a vendor under contract with us. So we started, Jim, what we call the South Carolina Tobacco e-referral hub, because we found that the functionality and then interoperability of just trying to do it on our own, direct to Optum, wasn't working. We needed a vendor with the technology capacity to help different EHR vendors to customize with different EHR vendors. And TellAsk is that company. So what they do is they work with the Epics and the Cerners and the Allscripts and the eClinicalWorks with different medical providers and health systems. And they customize and work with their IT folks, and they implement, and that's what Erin's job is. She works with them, with their IT folks, and they implement the patient referrals that get, Erin, you're going to have to help me on this one as well. Give her a microphone as well. But they ingest patient files. When they're ready to make a referral, they ingest patient files through TellAsk system, and TellAsk manages those patient files and sends them directly in batch, electronic batch, to the Quitline, to Optum. Optum gets those files and treats them like a referral, deals with them, and contacts the patient, gets them enrolled, and whatever, if the patient was reached, and everything that's with a standard referral, Optum returns those results back to TellAsk, and TellAsk handles them and processes them and sends those outcomes back to the provider. So it's still a bi-directional loop, but we've got an e-hub that's managing it so that the provider doesn't have to do anything manual. And the intent is that everything's seamless and bi-directional, and the feeds come directly back into the electronic record. That's the intent, because we had problems and barriers, and we needed a solution. And our e-hub with a technology provider was the solution. Thankfully, we had the budget to be able to do this. Did that answer your question? Did I even? No. TellAsk works with us. Yes, absolutely. Absolutely, yeah. I mean, a provider, when a doctor wants to refer a patient, and they're referring from Epic. Well, with Chad, y'all have Epic? Okay, so Chad, your providers are referring to the Quitline through Epic, and they're pushing the buttons.
So they're on an opt-out program. So sorry, I'm probably
go ahead. Yeah, tell. That'll help it. That'll help out.
Katy did a great description of the bidirectional process, and really TellAsk sits in the middle. So we are the technology platform that's allowing the data to travel from end to end. And so with Epic and with Chad and Gibbs, they are in an opt-out program. So anyone who answers the question that they're a tobacco user or an affirmative, they are provided to TellAsk. And then we reach out to them, we ask them some questions, and those who raise their hand and say yes are then transferred over to the Quitline. So this is something where the providers don't have to click the button every single time. They do have the ability to, if they have somebody in front of them, but we are knowing that the opt-out process is really the gold standard we're moving toward.
And that's the IVR component, right?
So it's not only IVR. We're using 3 modalities. It's SMS, email, and IVR. So we are reaching people in the modality that they prefer.
So we're using text messaging, we're using email, and we're using interactive voice response. So basically what we've done is we're using as many technology modalities to engage the patient, because when providers would fax a referral in, patients would not answer the phone, and providers can refer 100 patients, and if only 10 answer the phone and get enrolled, we've lost 90 patients. And that's wasting providers' time and wasting patients' time, wasting Optum's time. So what we've tried to do is increase patient engagement. That's our goal, and get them enrolled in services. Did that help? Thank you. Okay, that was a long-winded answer, but it's complicated, but it's technology. Dr. Keeley.
Dr. Wynne, yeah. Yeah, I'm Dave Keeley. I'm the chair for Tobacco Free York County Coalition and a former board member for Smokefree SC. Changing gears a little bit, I was interested in the other on your partnership slide, and could you comment to the degree that it's in your area of coverage, pharmacists, dentists, pediatricians in particular, what kind of partnerships exist or are you pursuing?
We tried to start something years ago, Dr. Keeley, with the South Carolina Pharmacy Association, and I have worked with Sarah Ball in the past on a project. We never got a lot of traction with them, but we definitely need to be doing something with them, so I'll admit we do. Dentists, we have worked with Dr. Lala internally in our dental program, done things with them, and it's been a hit or miss along the way as well. So more needs to be done in that area. Pediatricians, absolutely. We have done a lot with our pediatric folks, but in fact, our center, we have one pediatric practice that we're getting ready to re-engage, which is the Center for Pediatric Medicine. Dr. Lochran Grant, who retired from there, and she came to the Vaping Smoke-Free Conference back when it started in 2019, I think. We are going to work with them on electronic referral. So the pediatric practice, and we've worked with the South Carolina Academy of Pediatrics. So we've worked with the different doctors there. So yes, we're on it with the pediatric folks. So, and I'm going to actually be reaching out to CPM next week. We're going to be talking about that this week, y'all. So pediatrics as well. Pediatrics is interesting because the electronic piece is rough because the parent is not the primary patient. So we're working on solutions there as well. But thank you for that question. But yes.
We've got time for maybe two more questions. Anybody?
Those are good questions, y'all. Thank you.
My name is Evita Woods, and I'm at the DHA, the military department calling Building Healthy Military.
She's one of our newest partners as well.
Building healthy military communities. I'm interested in the referrals because the population that we're serving, being the Guard reserves and the reserves, how do I get them? I know it's usually through their primary to make those connections, but what about those that are on installation where they're seen by the doctors on bases or installations? How do we get those referrals connected?
You can use our DHEC 1617 fax referral form, and we can provide them with that form, and that's what they can use just to fax to the Quitline. So fax is not going away yet.
Okay.
So Vita, we'll talk about that, okay? Absolutely. Yeah.
Anybody else? Question for Katy, South Carolina Tobacco Quitline? That was fabulous. Thank you for all the
Rebecca.
information.
Y'all, thank y'all.